Well, good afternoon. Joe McComb, Mayor, and we will get our daily briefing, our weekly briefing now, started for November the 24th. Just want to remind everyone that we're coming up on the Thanksgiving weekend, as if you don't know that, but we just want to remind you that the fact that it's here really, I think, ought to give us time to pause, to think about how much we have to be thankful for. This has been a rough year, and it's not over. But if you list all the things you have to be thankful for on one side of your big chief tablet, and you put the other things that you have to worry about on the other side of your big chief tablet, I believe you'll find there'll be so much more to be thankful for, and that's what this time of the year is. So, and besides family and all of the folks that have been paying attention to us, the doctors, the nurses, the first responders, I just want to say how much I do appreciate them, and Judge Canales for the hours that she spent in trying to get all this figured out. I don't know when she sleeps, but she's been putting in many, many hours on this, and the folks from A&M Corpus Christi. I'm not much of a statistician, but these guys seem to have whatever goes into the soup to make it work, and the numbers are accurate, and we appreciate that. But another item of good news is that the vaccine appears to have been discovered or developed, and I think our health director will give us some more information on that as to the vaccine and the timing and when we might expect that. So that's extremely good news right here at Thanksgiving. And so we do have a lot to be thankful for, but I just want to remind everybody to be careful during the holidays. Don't get carried away. Let your guard down. Remember to keep your mask handy, and take care of yourself and your family. I can assure you that no one here is telling families not to meet for Thanksgiving. We're not telling anybody to call 911 if your neighbor's got 9 or 10 people at their house. The folks on the East Coast, if they want to do that, that's their business. I think Corpus Christians and South Texans have enough common sense to do the right things and take care of themselves, and yet at the same time enjoy their family, and again, just review the things that we have to be thankful for. So at this time, I'd like to call on Judge Canales to come up and make her comments, and then Annette Rodriguez will come and share with us some information on the vaccine, and then the university folks will come up and tell us what their prognostication is. Hopefully it's positive, but with the numbers I've seen, it takes a real optimist to turn that around. And as I mentioned the other day, if you're in the stock market business, you like to see these things go up, but we're not in the stock market business. We want these back down at zero, so we need your help on that. And when you hear the numbers and other things that are going to be shared with you today, I think you'll understand. So first, have a wonderful Thanksgiving, and remember what you have to be thankful for, and let's be healthy and happy following Thanksgiving. Judge Canales.
Le quiero recordar de tomar todas sus precauciones durante las celebraciones del Día de Acción de Gracias y ver en una balanza qué tenemos que agradecer a pesar de tener un año tan complicado. Queremos agradecer a todos los elementos de emergencia y médicos, así como a la juez del condado y al equipo de Texas A&M. También a la directora del Departamento de Salud, quien nos va a dar más información sobre la posible vacuna contra el COVID-19. Tome sus precauciones, celebre con sentido común, nadie le está prohibiendo reunirse con sus familiares. Ahora la juez del condado, Bárbara Canales, nos va a dar su reporte.
Good afternoon, everybody. Barbara Canales, Nueces County Judge. My outline today is also going to be talking about the holidays and all the health reminders. And in order to be safe, I want to talk about testing. And then, of course, I'm going to gear up for another county election process, and so I want to talk to you a little bit about runoff election safety. So first, as we head into this holiday week, like the mayor said, I too wish to give thanks, and I'd like to share with you some of the things that I'm most thankful for. including the health of my family and the entire team of City County Public Health. It's been an unbelievable opportunity to serve alongside with them, and serving you, which is this great community of ours, is really something to be thankful for. I think given the adversity as we faced as a community this year, it's important to acknowledge thanks. There are so many wonderful things that are happening in our lives, and if possible, sharing our blessings with those that are less fortunate than us means that we stop and give thanks. One of the most important things we can do for our families during this time, and of course our community and our healthcare workers, is to plan a safe Thanksgiving, which will begin the safe holiday season. Now, I'm jumping ahead of my notes, but I know you know that nuecesknows.com is the place to go for all of your information with regards to tips for a safe holiday season. And one of the ways that we've all adapted is by understanding that sharing our moments doesn't mean that we have to share the virus. And so while we traditionally gather at Thanksgiving, the safest option, of course, is the safest of all things would be to hold a virtual celebration or celebrate those who are with those that are living in your household. That means your small immediate family. But if you're planning some sort of a gathering, here's the thing. You need to follow the CDC rules and tips and guidelines because it's going to help keep everybody safe. And you can find all of those tips and any information that you need to know, here it comes, on nuecesknows.com. And that site is really something we're very proud of, and I want you to share it with your members of your family as they join you around your Thanksgiving table. And so many people have called us, emailed us, texted us, wanting to know about their gatherings. You know what I've figured out is that people really want to be safe. They really want to do it the right way. It's just that so often we're tempted to just let our guard down because it's so easy to feel good by being surrounded by people we love. And so I want to make sure that you think about your Thanksgiving dinner. Plan it like you plan your menu. Plan safety around this beautiful holiday. And so as we recognize that Thanksgiving dinner is often a long, relaxed, multi-course meal with all the family stories and the second and third helpings, in normal times, you might enjoy this meal maybe even at a restaurant. And so we're going to encourage everybody to make certain that you go to places that are doing it safely. And we greatly appreciate all of our local businesses, especially our restaurants and food providers that have worked so hard to adapt for safety and health for both their workforce and for their patrons. But of course, don't forget, so many of them offer drive-through and takeout. Use those mechanisms because those are going to be your really best bet, particularly if you have someone that lives with you that's a vulnerable population member. So if you're celebrating Thanksgiving and someone around your immediate family is a vulnerable person, you need to take every precaution right now that you can to ensure their safety. So while, again, as I said, we have restaurants that are open and many are offering dine-in service, don't forget they're also offering drive-through service. So enjoy your holidays. We want you to do it as safely as possible. You know why? Because we want to enjoy them the right way next year, and that's together without these. So let's talk about ways that you can also be very safe. I'm worried about all my kids coming home from colleges, and some families are going to see this happen in their homes as well. Or sometimes it's just your grown-up children coming in to see you. And if they haven't had the opportunity to quarantine, we want to let you know we've got free testing tomorrow. And we would love for you guys to be able to have that peace and security and reassurance. So we're going to talk to you about free COVID testing tomorrow from 9 a.m. to 1 p.m. Now, we also have testing scheduled for all next week. And I am so sorry, but the schedule hasn't quite been firmed up. But just know that if you'll jump on our website, either the cities or the counties or Nueces knows, we're going to be able to provide you next week's schedule. But make no mistake, we know we're going to need a lot of testing next week, and so we're getting geared up for it. But what I can tell you is tomorrow at the Richard Borchert Fairgrounds, from 9 a.m. to 1 p.m., we have our free testing available to you and to your family. And remember, it's for everybody. You don't even have to have symptoms. So no appointment is required. It's done by a mouth swab. Let me tell you, that's the better one, okay? But it's the one that everybody loves, Annette. I don't know why nobody likes the swab up their nose touching their brain. I cannot figure it out. But this one, the 9 a.m. to 1 p.m. is your mouth. So it's free. It's fast. It's as comfortable as it's going to be. But you know what it's going to do? It's going to keep you and your family safe. So if you're worried about possible exposure, if you're worried that the kids have been around too many people, go and get them tested. So that's all there is to say about that, because I think that we really already know all the 3 W's. And you're going to practice them right along with turkey and dressing. Washing your hands, wearing that mask whenever you're not at that supper table, and of course, watching your social distance. So instead of that family gathering, everyone's squeezed in around the table, no one's going to mind this year to keep everybody alive. Move away from one another. Just like we have seats that are empty, you too can do that in your home. Now, just as a final, at the county courthouse, we're very proud of the fact that we've conducted a very safe election season. And so I want to extend our thanks to the clerk and her staff who've been working tirelessly to get ready for a runoff election. That runoff election is for 3 important positions: the Corpus Christi City Government, the Mayor, City Council District 1, and City Council District 4. And I just want to remind everybody that the election will have early voting from Monday, December 7th to Friday, December 11th. Election day, of course, is December 15th. So you're going to be hearing a lot from us about voter safety, and everything we wanted you to do in the general election is going to apply in the runoff. So please vote safe, Nueces. So in conclusion, I really hope that you can use the rest of the weekend to take some time to reflect. Reflect, as the mayor said, reflect on the good stuff. There's so many good things that I bet you can point out in your year that have happened. I know I personally am guilty of saying I can't wait to get rid of 2020. I want it in the rearview mirror. But then I would forget about all the good moments and all the times that we've really fought side by side together. And so I think it's important to acknowledge that when family and friends and neighbors and governments and healthcare providers come together, how could that not be the good stuff? Everything about 2020 has been a team effort. And the fact that we've said we're all in this together hasn't just made it bearable, it's made it inspiring. And though we may only be enjoying it with our immediate families, our sharing stories online can continue. Our relatives can gather around one table. It'll just be the table of our family spirit. And when you do pause to give thanks, please remember all of those who make days like this possible. From the truck driver who's bringing the food to HEB. I know I personally have been 3 times, even though I want to warn everybody, stop that. Go and get everything you need once and then get home. And I'm grateful for all those people that I see working at HEB and Sprouts and all you other small grocers too. And I'm grateful for the people that when you're tired of cooking, you can go to the drive-thru and pick up your favorite food at your favorite restaurant. I'm grateful for the people that are always working to keep the lights on, the power up, the internet connected, our first responders, and our medical workers. These people are what thanks and giving are all about, and they deserve our thanks today and every day. And this is a uniquely American holiday. It's a day we purposefully set aside to reflect on the good in our lives. We count our blessings, we renew our spirit, we give thanks for our strength and for our belief that no matter what adversity life brings us, we can face it together. I'm thankful for the opportunity to serve as your county judge, and I'm grateful for all of you who give my service meaning and purpose. I'm not certain that I'm thankful for everything that's happened in 2020, COVID-19, Mayor, but I am thankful for the men and women that make up city and county government, and I'm thankful for our state leadership. And for the national leadership that's to come, I can tell you the best line of 2020 for me is not keeping the faith, it's spreading it. So, thank you, and especially to you, Annette. Every day, I'm getting calls from people whose parents they will never see again. They ask me if there's anything I can do. You know what the worst feeling in the world is? This is about the best I can do right now, is by communicating with you how serious it is to do exactly as Director Rodriguez and her staff have been asking. And if it weren't for her and for her tireless staff, we would not be in the position that we're in today, which is, as difficult as this surge is, we are still best equipped. We have a COVID clinic. We have an incredible testing program. We have an alternate care site inside our hospitals. We have resources that very few communities have, and that is truly in thanks, all in part to our city county public health. And so I really want everybody to think about the people that are constantly working, constantly thinking about the next way to keep you safe. And now you're about to hear from Annette with a little message of hope, because in keeping with that, she's been working on a vaccine management plan, and that is the promise of tomorrow. Thank you all, and I hope you do have a very, very blessed holiday.
Dada la adversidad que hemos enfrentado como comunidad este año, es importante dar gracias por todas las cosas maravillosas en nuestras vidas y, si es posible, compartir nuestras bendiciones con los menos afortunados que nosotros. Por lo que es importante que planifique un día de acción de gracias seguro. Si está planeando algún tipo de reunión, siga algunos consejos de los Centros de Control de Enfermedades. Estos los puede encontrar en el portal nuecesnows.com. Si va a obtener comida ya cocinada, elija servicio para llevar o de entrega a domicilio. En cuanto a las pruebas para el COVID-19, para aquellos estudiantes que regresan a sus casas durante esta temporada, se va a llevar a cabo la toma de pruebas el día de mañana y el viernes, de 9 de la mañana a 1 de la tarde en el Centro de Exposición Richard Borchardt en Robstown. La prueba es gratuita y está disponible para todos. No se requiere de cita y esta prueba se realiza con un hisopo bucal, no con un hisopo nasal. Es rápido y cómodo. La próxima semana también se va a llevar a cabo la toma de especímenes, aunque usted no tenga síntomas. En cuanto a la elección de desempate, son 3 las posiciones que se debaten: la de alcalde, de Distrito 1 y 4 del Consejo de la Ciudad. La votación por anticipado para esta elección se llevará a cabo del día lunes 7 de diciembre hasta el viernes 11 de diciembre. El día de las elecciones es el martes 15 de diciembre. Para más información puede visitar el portal votesafenueces.com. Le pido agradecer a todas las personas que hacen una diferencia en nuestra vida, así como lo han hecho los trabajadores más indispensables y que han hecho que podamos sobrellevar esta situación. Ahora la directora del Departamento de Salud Pública, Annette Rodríguez, nos va a dar su reporte.
Thank you. Annette Rodriguez, Public Health Director. I'm going to start with the COVID-19 statistics. First slide, please. There it is. So this basically shows the daily COVID-19 cases here in Nueces County. So you can clearly see that on the far right side, the numbers were in the 50s and then kind of wobbled 80, 50, down to 7 in one day, and then 60, 70, 170, 200, 217. And so the numbers are still high today at 148 COVID-19 cases in Nueces County. So does that indicate a second wave? No, but all of these numbers combined do indicate that we're on the verge of a second wave. Next slide, please. So this diagram basically shows that there's a total of 23,536 total cases in Nueces County, which 21,381 have recovered, but there's also been 472 people that have lost their lives to COVID-19 here, and leaves a number 1,683 active cases in Nueces County currently. These individuals all should be in isolation, and they have people that have been exposed to them that should be in quarantine. Next slide. These are the hospitalizations as of today. 132 are in the hospital with COVID-19. You can see on the far right-hand side, we were at 86. If you look 2 weeks prior to that, we were in our 50s for hospitalizations, and we were trying to get below that before this second wave started coming. And so we started at a baseline of 50, and we're already at 132 hospitalizations in just one day for COVID-19 patients. Next slide. These are people that are in the intensive care unit here in Nueces County, and so total for today, 39, which is down from yesterday. We had 47, but we know that not all people recover. You know, we had 2 people that lost their lives to COVID-19 today, and our hearts go out to those families of those 2 individuals. Next slide. So bringing the total death rate for Nueces County up to 472 with the 2 that I just mentioned today. So, and the last slide is basically showing you the first wave, which we all know was around July 14th when we peaked at 605 cases. And so now you see the red line, you see the bar graphs over here, the numbers are going up, so you know that we're in our second wave of cases. The 7-day average is 169 daily cases every day for the last 7-day average, which is really unbelievably high from where we were a few weeks ago. So I'm going to talk a little bit about what's going on at the health district. So we do continue to hold our drive-through COVID-19 testing, and our next drive-through will be this coming Saturday at 8:30 in the morning at the health district. You can self-register for the drive-through at cctexas.com/coronavirus and click on the drive-through link. The latest information on the COVID-19 vaccine indicates that the first distribution of COVID-19 vaccine may begin arriving by mid-December. That's a few weeks from now. While there may only be a few doses of vaccine earmarked for the healthcare workers initially, it is the beginning of doses arriving in our community and something that is really needed. A vaccine, along with therapeutics, which we started receiving last week in small doses, will be the most effective way of ending this pandemic. The COVID-19 virus will become another virus, like the seasonal flu virus, that we most likely will just have to learn to live with. The health district is preparing for this mass distribution of the COVID-19 vaccine and microplanning currently. Microplanning is planning the minute details of how the vaccine will be distributed efficiently and safely. However, while we wait for the vaccine, it is imperative that everyone continues to actively practice the public health measures that the judge mentioned, the 3 Ws, and we're all familiar with. We have all seen in July how quickly the virus can spread, causing high number of hospitalizations and deaths. As Thanksgiving approaches, we are already experiencing steady increases in our daily COVID-19 cases. These increases are very disconcerting for public health as well as our medical community. It indicates that any additional cases added to our already rising numbers will cause additional strain on our healthcare system. We are asking that all residents be diligent about using all precautionary measures available. While we realize that this is an unprecedented pandemic, and we understand that this is no one's fault that we're in the predicament that we're in currently, we also understand that personal choices and personal behavior will make a difference on what happens to our numbers here in Nueces County. Here's what we know about the vaccine that we will be receiving. There are now 3 vaccine candidates that look promising for getting some protection against COVID-19 to our communities soon. They are Pfizer, which has already submitted an EUA, Emergency Use Authorization, to the FDA. The FDA is scheduled to meet December 10th, and we believe that they will give their approval at that time. Quickly after, within 4 or 5 days, they will start sending us vaccine so we can start administering it to the named priority groups. The other 2 vaccine candidates that are following closely behind Pfizer are Moderna and AstraZeneca. You may remember AstraZeneca was on pause, but now they are rolling full steam ahead, and they look like they may have a vaccine here very soon that's ready to be distributed. All 3 of these companies have COVID-19 vaccine that require 2 doses. One is 21 days apart, and the other 2 are 28 days apart, depending on which vaccine you receive. The 2 doses have to be received from the same vaccine candidate. So if you receive your first dose from Pfizer, you must get your second dose from Pfizer. The same is true for Moderna and AstraZeneca. You cannot mix doses between 2 different vaccine companies. Pfizer has demonstrated an observed efficacy of their vaccine to be 95% effective, and in adults 65 years and older, they have a 94% effectiveness, which is truly amazing. They also have not seen any serious side effects, but have noted some people have experienced headaches or fatigue. So here's the updated information as of today on who will be prioritized to receive Phase 1A, first tier. This is the group. Number 1, hospital staff working directly with patients who are positive or at high risk for COVID-19. This includes physicians, nurses, respiratory therapists, and other support staff, including custodial staff working in those areas. Also, additional clinical staff providing supportive laboratory, pharmacy, diagnostic, and/or rehabilitation services. Number 2, they're also in the Phase 1A first tier to receive the vaccine. Long-term care staff working directly with vulnerable residents. Who does this include? Direct care providers at nursing homes. So who are the individuals that are actually leaving the nursing homes? It's only the workers. So the workers would actually get the vaccine. Assisted living facilities and state-supported living centers. Also physicians, nurses, personal care assistants, custodial, food service staff. Number 3, EMS providers who engage in 911 emergency services like pre-hospital care and transport of patients. Number 4, home health care workers, including hospice care, who directly interface with vulnerable and high-risk patients. That's Phase 1, first tier. Then, as more vaccine arrives, there will be Phase 1A, second tier. This group includes, next slide. This group includes the staff in the outpatient care offices who interact with symptomatic patients, which includes physicians, nurses, respiratory therapists, and other support staff, custodial staff working in those areas as well. Clinical staff providing diagnostic, laboratory, and/or rehabilitation services. Also, non-911 transportation for routine care. Number 2, direct care staff in freestanding emergency medical centers and urgent care clinics. Number 3, community pharmacy staff who may provide direct services to clients, including vaccination or testing for individuals who have COVID-19. Number 4, public health and emergency response staff directly involved in administration of COVID-19 testing and vaccination. And number 5, the last responders who provide mortuary or death services to descendants with COVID-19, which includes embalmers and funeral home workers who have direct contact, also medical examiners and other medical certified individuals who have direct contact with the descendants. And number 6, nurses that work in the schools around COVID-19 positive faculty and students. So those are the priority groups currently listed. Everybody's been asking us who are the priority groups. Those are the first group of priority. They have not given us the priority groups for the other categories at this time. So I'm going to change gears for just a few minutes to Thanksgiving. The Health District wants to recommend, as we have been, that if you celebrate this Thanksgiving, that you celebrate only with those individuals who live in your household. However, if you choose to host a gathering, keep it outdoors. Keep it small with only household members and extended family members, and keep those masks on. Make certain everyone wears a mask properly. That means covering their nose and mouth. Washes their hands often, practices social distance, and eats at separate tables with people from their own household. Everyone will be taking off their masks to eat, so make sure you keep them separate. When you finished eating, everyone should put their masks back on for the entire time that they are gathered. If your gathering is indoors, everyone wears the mask the entire time, and open up your windows in your home to keep the air circulating and discourage behaviors such as hugging and singing and playing games that involve sharing one cell phone and passing it around, and even handshaking. If every single person does their part this holiday season, we may be able to keep our numbers where they are now or even lower them. Despite having to endure a pandemic like we've never seen before, one that has caused a lot of pain and suffering, we still have a lot to be thankful for. We in public health are thankful for each of you in our community that wears masks and does what is being asked in an effort to keep each other safe. Stay safe, stay alert to your surroundings, and as always, stay informed on what our cases are doing locally and also around the world. May you have a happy and blessed Thanksgiving. Thank you.
En las últimas 24 horas se han reportado 148 casos positivos por el coronavirus. 21.381 pacientes se han recuperado por completo. 132 se encuentran hospitalizados. 39 de ellos están en la unidad de cuidados intensivos. 1.683 son casos aún activos. El día de hoy se reportan 2 fallecimientos. A la fecha, los fallecimientos totalizan 472 personas. 169 casos diarios es el promedio de la última semana. El Distrito de Salud continúa llevando a cabo las pruebas. Si usted cuenta con síntomas y quiere que se le haga una prueba, puede registrarse en www.cctexas.com/coronavirus. La vacuna de prevención del COVID-19 se espera llegue a nuestra área a mediados de diciembre. Desde la semana pasada hemos comenzado a recibir tratamientos en pequeñas dosis. Esta será la forma más eficaz de acabar con la pandemia. El Distrito de Salud se prepara para la distribución masiva de la vacuna de prevención del COVID, pero mientras esperamos la vacuna, es de suma importancia que sigan practicando las medidas de salud pública. A medida que se acerca el Día de Acción de Gracias, ya estamos experimentando aumentos constantes en nuestros casos diarios por COVID. Estos aumentos van a estresar aún más nuestro sistema de salud. Actualmente existen 3 vacunas candidatas. La primera de la farmacéutica Pfizer, que ya ha presentado una autorización de uso de emergencia de la FDA. Esa decisión se dará a conocer el 10 de diciembre. Las otras 2 son de Moderna y AstraZeneca. Las 3 empresas tienen vacunas que requieren 2 dosis. Pfizer ha demostrado que la eficacia de su vacuna es 95% efectiva. En cuanto a quienes van a tener prioridad para recibir esa vacuna, el grupo de la fase 1A es personal del hospital que trabaja directamente con pacientes positivos, personal de cuidados a largo plazo, proveedores de servicios médicos de emergencia y trabajadores de atención médica domiciliaria. El grupo de segundo nivel están el personal en consultorios de atención ambulatoria, personal de atención en clínicas y salas de urgencia, personal de la farmacia comunitaria que da servicios de vacunación, personal de salud pública, personal de servicios mortuorios y enfermeras que trabajan en las escuelas alrededor de profesores y estudiantes. En cuanto al Día de Acción de Gracias, el Distrito de Salud recomienda que celebre este Día de Acción de Gracias solo con las personas que viven con usted, pero si realiza una reunión, hágala al aire libre. Use su cubrebocas, lave sus manos con frecuencias, practique el distanciamiento social y si hace de su parte, esperamos reducir el número de contagios.
Good evening, everybody. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Coastal Bend COVID-19 Task Force. You'll notice that for the first time in 8 months, I'm not wearing my signature Aloha shirt, but I'm wearing a shirt because I gave convalescent plasma today. If you don't know, I contracted COVID-19 in August, and I've recovered since then, and If you're thinking about donating blood or donating plasma, we're coming into an important time right now based upon the projections I'm going to show you. You can go to the Coastal Bend Blood Center, find it online. It was very easy. Yesterday, I typed in a few pieces of information. Today, they contacted me, and now I've donated the plasma. It's very easy to do. The task force objectives are twofold. Number one, we want to address public concerns and questions about COVID-19 and the interventions that are taking place to combat COVID-19. I want to point out to you that we're going to be transitioning. We might not give too many more of these live conferences, and we're transitioning to a broader social media platform across Twitter, Facebook, and Instagram. CB COVID is our handle, so if you want to go and follow us there, you can get the most up-to-date information, projections on COVID-19. That will be updated every day, not just on Tuesdays. We're also here to enable evidence-based decision-making. We deliver data and information analysis directly to your city and county leaders here in the Coastal Bend so that they can make the best decisions possible, as well as to the hospitals and doctors in the Coastal Bend also. There's several interventions that are in place. If you're in a group that's considered to be at a high risk to COVID symptoms, you're urged to stay at home if you can. Everybody's encouraged to wear face coverings and social distance. And remember, 6 feet inside isn't far enough for an aerosolized virus like coronavirus. And so you want to stay as far away as you can, pretty much. Isolate when exposed or symptomatic. And if you're waiting on a test, isolate until you get the result of that test. Don't assume that the test is going to come back negative. You should assume that's going to come back positive. If it comes back negative, then you'll be very happy and you can stop isolating. Partially remote schooling is still taking place. I know at the university, we're wrapping up classes tomorrow at 12 p.m., and that's pretty much wrapping up classes for the whole semester. That's not normal, so the university's changed their whole schedule so that there's not as many students coming back to campus after the Thanksgiving holiday. And we're in Open Texas Phase 3. Which means that businesses are allowed to operate at 75% of their total capacity, and bars are able to operate at 50% of their total capacity. Okay, we've had a lot of confirmed cases in the Coastal Bend, almost 27,000, 26,500 or so cases, almost as many recoveries. But I want to point out the number of active cases. This number has risen by 66% since last week. At 1,807. And again, to point out that the numbers that you hear for Nueces County are different than the numbers for the Coastal Bend, and the Nueces County numbers that you hear are a day newer. We don't get the Coastal Bend from every county data till a day later, so that might account for any discrepancies in the numbers that you might see here. Fatalities is at almost 750. We're at 749 fatalities in the Coastal Bend. So this is a large amount of people. More than 1 in every 1,000 people in the Coastal Bend has died from COVID-19. We're expecting that by the end of February, this number might double. And we'll be at more than 2 in every 1,000 having died from COVID-19 in the Coastal Bend. The inset figure at the upper left shows the general trend in fatalities per day, and you can see that we're at the bottom, or the trough. Now, you might think, well, how come there's so few fatalities when there's so many cases right now? Well, when you test positive, the people that die don't die as they're testing positive. They usually die a few weeks later. So there's a delay between when you contract COVID and when you test positive. If you go to the hospital, there's a delay usually to when you do that, and then there's a delay for the people that unfortunately do die until they do. In terms of new cases per day at the 12 counties in the Coastal Bend, you can see Nueces is launching. And it may not be easy to appreciate on the graphs that you saw earlier, and the y-axis scale, the up and down scale affects what you see and whether you perceive a steep incline or a more shallow incline. These are the same graphics and same axes I've been showing the whole time, so you can see that your eyes don't deceive you. There's a very steep increase in the amount of COVID-19 in the coastal bend right now, especially in Nueces County. The other counties in the coastal bend, they're dwarfed by Nueces County's numbers, but there's also a lot less people there. They're all off of zero and fluctuating. COVID-19 is up in the whole coastal bend, not just Nueces. If we look out a little farther to South Texas, I know people are thinking about traveling over Thanksgiving. If you want to be safe, if you want to give thanks without giving COVID, we recommend that you don't travel. But if you do, we think it's important for you to know what's happening in the surrounding areas. So in South Texas, Laredo is a little bit ahead of us in the outbreak, and they're at the same level they were in the middle of the summer at the peak of their outbreak. So there's a lot of COVID in Laredo right now. McAllen's not too far behind, increasing rapidly. San Patricio, on a per capita basis, is increasing very rapidly, right on pace with Nueces. And then Victoria and San Antonio are somewhat farther behind, followed by Aransas and Brownsville. So across South Texas, COVID is up. Now across all of Texas, COVID is up. So if you're planning to travel somewhere in Texas, chances are there's an active COVID outbreak there. In Amarillo and El Paso and Lubbock, this northwest area of Texas, COVID is coming down, but the numbers are still really high. So even though there's a downward trend, that's not going to really protect you from getting COVID. And that trend could change depending on what happens during Thanksgiving weekend. Dallas and Fort Worth area going up, South Texas, which is us. You can see we're increasing a little bit more steeply, and if we keep on this same trend, we might catch the Dallas-Fort Worth area and surpass them. Not something that we want to do. Houston, Austin, and San Antonio and Longview are not quite up to where we are, but nonetheless, they're trending upwards. So across all of Texas, we're in the fall outbreak. It started in Amarillo, El Paso, and Lubbock. The peak already passed, and they're on their way back down. But for the rest of us, it's just getting started. So here's our projection. And the projection hasn't changed. The model hasn't changed. We still are estimating the same transmission rate. But the first thing I want to point out is that the number I'm going to show you this week is a little lower than last week. And the reason why is because we're accounting now in this number for how many people have contracted COVID as well as the transmission dynamics. So we were estimating 1.8, but what was happening was of that 1.8, 0.4 were transmissions to people that already had COVID, so those don't count. So 1.4 is the number. There's no change from last week, just a change in that number that I'm showing you. The projection is the same. Now there's something else that changed this week from last week. It's that our hospital capacity is decreasing. And as the hospital capacity decreases, the number of patients that are COVID positive that triggers the 15% threshold becomes less. And so the way the model manifests is that we have a projection that we're going to hit the threshold a day earlier. So now instead of December 14th shifting to the 50% capacity in businesses, we're looking at December 13th shifting to the 50% capacity in businesses because the hospital capacity is declining. Now, presumably that hospital capacity is declining because FEMA nurses and doctors, and even nurses that were full-time here, are going to other places to get paid more by FEMA, and in the places that need their help more than we do right now. Now, the thing is with that is that by the time we're in the outbreak, we don't know if we're going to get those nurses back. So this is really something that we should be paying attention to. And if for no other reason that you try to stop spreading COVID, it's not really about yourself. It's about trying to make it so that our hospital system will still work, so that those that need care can get it. So now let's talk about some scenarios. So what happens if we keep moving the way we have been? So for the past several weeks, I've been projecting the same thing. We're going to have a peak. We're going to shift to 50% business capacity on December 14th, now 13th. So that's our scenario one. More of the same is what I'm calling it. It's based upon what happened in the summer. You can see that at this point, it's been fairly accurate. We can't predict what's going to happen in the future. We're not fortune tellers, but we can look at what happened before and parameterize the model, and it's almost exactly predicted what's happened thus far. Now, what didn't happen over the summer was something like Thanksgiving. And so what could happen with Thanksgiving is this could kind of supercharge COVID in the coastal bend and across Texas and across the country, depending on how we respond to it. So that's scenario 2. What happens if we just have a normal Thanksgiving? You know, let's have a little vacation from Wednesday through Sunday. You know, the period of Thanksgiving, usually people are traveling on Wednesday, and then, you know, the dinners on Thursday, the shopping on Friday, and other family get-togethers that occur the rest of the weekend. What happens if we treat this Thanksgiving just like 2019 or any other Thanksgiving we had in our lives? And this is what more of the same looks like. So we're projecting that the hospitalizations in the coastal bend from COVID-19 will peak at about the same level, maybe a little bit higher than they did in the summer, but this time we might have fewer support staff on hand. So it could be a bigger strain on the hospitals this time around. Now, if we go to that normal Thanksgiving celebration scenario where COVID could get a little supercharged, we're looking at 120 more patients at the peak in hospitals in the coastal bend. So this 120 more, it's not a trivial amount. It's a large amount more. It's a substantial proportion more patients that will put a huge strain on the local hospitals. We don't want this to happen. How about fatalities? Right now, we're projecting that the peak will be about the same number of fatalities per day as we had in the summer. We're looking at maybe doubling the number of fatalities overall in the coastal bend by the end of February. But if we have our 5 days of normal Thanksgiving, we're looking at 100 more fatalities over that time period. Again, that's a large proportion. So I think everybody needs to consider, while you're giving thanks this holiday, do you want to give COVID or not? And hopefully a lot of you fall on the side of not wanting to give COVID during Thanksgiving. So here's some ways that you can give thanks without giving COVID. Avoid travel if you can. But, I mean, let's face it. I know a lot of people that are traveling. You know a lot of people that are traveling. You might be traveling yourself if you're listening to this right now. If you're traveling, get the flu shot. Mask up, wash your hands, don't touch anything. Do everything you can to not transmit COVID or contract it while you're traveling. And remember, you might think, well, I don't feel sick. Well, there's a large proportion of people that transmit COVID that don't feel sick because they're either pre-symptomatic, because you're contagious, you're the most contagious before you feel your symptoms on average, or there's a large proportion of people that transmit COVID that never are symptomatic. So those two things, even though you don't feel sick, doesn't mean that you can't be transmitting it. Next, protect the vulnerable, celebrate virtually. I'm doing this, but my mother lives in Connecticut, so it's not gonna be very easy to do an in-person Thanksgiving with her anyway. But what we're going to do is we're going to set up a Zoom time, and we're going to eat our Thanksgiving dinner together virtually through the computer. It's not going to be the greatest Thanksgiving ever, but at least she doesn't have to be alone in her apartment while she's eating her Thanksgiving dinner. So this is something that could really help to protect our vulnerable populations. Director Rodriguez already gave a lot of great tips, and these are kind of a recapitulation of that. But if you're going to have a celebration, keep it single family. If you're not going to keep it single family, and again, I know people that are having multi-family celebrations. They don't want to let COVID get in the way of their Thanksgiving. If you're going to do this, open windows. We're in the coastal bend. It was great weather lately. There's no problem with opening your windows, and that will help keep the airflow and make you less likely to have if anybody's spreading COVID, it'll make it less likely that other people contract COVID in your house. There's a fan there blowing air out the window, circulating the air pretty well in there. If you have sterilizers in your HVAC system in your house, then run that too. Another great alternative, even better, is going outside, eating outside. Again, beautiful weather lately. You can BYO, so you're not sharing food amongst different households. Don't have a buffet. This year is not the year for a station where everybody in the family and all the other families that are at your house go to the same place and are using the same utensils to serve their food. So if you do these things, as well as the basics, wear a mask, social distance. Just because you're in the same family doesn't mean that you can't give each other COVID. And while I know some of us have sibling rivalries and you can't choose your family at the same time, I think that we want to live to either enjoy the holidays with our families in the future or live to fight another day with our families in the future, however, your Thanksgiving goes. So if you do these things, you can give thanks without giving COVID. So with that, I'd like to thank you very much, and we'll go to a translation.
El día de hoy realicé la donación de plasma convaleciente después de haber contraído el virus. Si usted quiere hacer una donación, ya sea de plasma o sangre, puede encontrar toda la información en la dirección coastalbendbloodcenter.org. La emisión de estas conferencias se va a ver reducida, pero nosotros vamos a continuar dando toda la información mediante las redes sociales, mediante Twitter y Facebook. Actualmente, en el área de la costa son 26,449 el total de casos positivos. 23,893 son las recuperaciones y se han reportado 749 fallecimientos. El condado de Nueces es el condado en el área de la costa con el mayor número de aumento en casos, seguido por Jim Wells. Mientras que la ciudad de Laredo, en el sur de Texas, es la ciudad con mayor número de casos. Esta información le servirá si planea viajar. El día de hoy, nuestra proyección en cuanto al radio de transmisión es de 1.4, mientras que la capacidad en los hospitales ha cambiado y se ha reducido, en parte debido a que muchos enfermeros han cambiado de ciudad y se han dedicado a ayudar en otros hospitales. Para la celebración del Día de Acción de Gracias, evite viajar y si lo va a hacer, tome sus precauciones. Cuide a los más vulnerables, especialmente a los adultos mayores. Visítelos de manera virtual. Si decide reunirse con amigos o familiares, hágalo en un lugar con buena ventilación. Mantenga el lugar limpio y libre de gérmenes. De preferencia, reúnase afuera. No sirva comida tipo buffet. Estas medidas ayudarán a reducir así los contagios.
Thank you. We're going to use our last few minutes here to answer some questions, and every time there's questions for Director Rodriguez, so I want to invite her down to the podium, and then we can start with some questions from Ms. Tiffany Anderson.
Hello. So, Annette, this will be a question for you. How many people can we treat with the antibody drug from Eli Lilly?
So, great question. How many people we can treat with the drug from Eli Lilly? Last week, we received 38 doses, and this week we received, how many? 34 doses. So that's as many people as you can treat, just those numbers. And so it's specific for individuals that are COVID-19 positive, that have mild or moderate symptoms, and even those that look like they may progress because of a comorbidity or something else to something worse. Those are the individuals that should be receiving the vaccine, the therapeutic doses.
And a follow-up question, are teachers on the list?
Our teachers on the list for
those.
For the phase 1 priority groups that we went through, they are not on the list. But that doesn't mean that there's not going to be more people on the list. This is just the first, bout of vaccine. What we do know is that Moderna is getting very close, and so we believe that there's going to be more vaccine, and so the list is going to be enhanced.
Okay. And will it be mandatory?
Never. So when you have a pandemic, the vaccines are voluntary. So if you want to get vaccinated, that's your option. We do hope that we can encourage as many people as possible to get vaccinated, because we know with any pandemic, your best defense is going to be, therapeutic doses, but that means you already have COVID-19, or prevent you from getting COVID completely by actually getting a vaccine.
Okay. How quick are the results for tomorrow's testing?
For tomorrow's testing, it's been taking a 2 to 3 day turnaround time for the TDAM, the Texas Department of Emergency Management. Used to be the military testing team, so it's about a 2 or 3 day turnaround time.
Okay, thank you.
You're welcome.
Either of you, what's the positivity rate?
Well, the positivity rate for our drive-through this morning was 24% based on the number that went through the drive-through, and the total was 117, and I believe 28 of them were positive, so it was 24%. So, and we've been seeing around 24, 25% positivity for all of our drive-throughs currently, so.
For comparison, my family in Connecticut and Massachusetts, they have 2% to 3% positives, and they think that it's really high.
Wow.
What's that like?
That hurt, Chris.
On a contextualize.
That's terrible, so.
And I think this was in the presentation, but what's the transmission rate?
The transmission rate right now is 1.4. So last week it was 1.4, the week before it was 1.4. So what that means is that for every person that contracts COVID, they're going to pass it on to 1 to 2 people. On average, it comes out to 1.4.
What happens if the transmission rate is under 1?
If the transmission rate goes below 1, then COVID declines. So right now in El Paso, Lubbock, and Amarillo, it appears that the transmission rate is below 1. They're in a different phase of open Texas than we are. They're down to businesses being at much lower capacity than normal. And that's how they're achieving that. Presumably, what we hope and is baked into our model is that when we hit those thresholds and the capacities go down, that our transmission rate goes below 1 also.
Okay, thank you. Any other questions?
All right, thank you.
Thanks again.
I want to remind everybody again, social media, find our handle, CB COVID. You search on that on Twitter, Instagram, or Facebook, and you'll find us, follow us, and we'll put daily updates there from here forward.
Seeing no other questions, that will end our press briefing at this time. Thank you all for being with us, and happy Thanksgiving to everybody. Thank you.